There's so many different things that Lyme can do to affect hormones. If you get exposed to Lyme disease and your body starts making antibodies to fight off the Lyme disease, then those antibodies see your thyroid and they think it's the Lyme. But it's not the Lyme, it's actually the thyroid that it's attacking.
Well, welcome to the podcast, Dr. Kelley. I'm super excited to talk about Lyme disease because I get asked this question a lot, mostly with women who have been told, maybe that's an answer to your puzzle piece. And they're like, I've been searching for things for years. So I think this is going to be a really valuable conversation. So can you tell me how you got here? You obviously have an MD. So how did we end up over here knowing so much about Lyme disease?
It's a great question because it's not really taught very much in med school, at least not where I went to med school in Ohio. But my course kind of went, a little sideways because I found in med school that I was really curious why people were sick, how they had these chronic illnesses. And we weren't really being taught to question that. We were being taught more how to diagnose and then how to treat, which is valuable information too, but there was lack of curiosity. And so I started kind of diving into more natural, holistic ways of approaching patients starting in med school. And then in residency, I started going to, which was back then the American Holistic Medical Association, conferences and functional medicine, and starting to see, oh my gosh, there's a whole bunch of other people who think like this and when are curious about this. And it's called integrative medicine. And this is my people. This is my tribe. And through that course, when you start to dive into this, you start to hear about Lyme disease, but it is also very controversial, still is. But doctors were losing their licenses pretty frequently trying to treat it. So it's scary at the same time. But I had my own health issues and I was going through a lot of my own health problems. I was diagnosed with postural orthostatic tachycardia syndrome while I was in med school, and chronic fatigue. And no one could really tell me why. And I tried different medications and tried different things to try to treat it. But then I just kept hearing about Lyme and hearing about Bartonella and these other co-infections. And eventually I just kind of had to break down and get myself tested. And lo and behold, those critters were there. So I treated them and I started to feel a lot better. So then I started looking for them in my patients and I started to find them. And once you start looking, you start to see it. And then when you start to actually help people get better who've been suffering for years with these mysterious symptoms, it's so rewarding and wonderful and lovely to help that and be there for that. You can't stop.
Yeah, no, I get that. I think it's crazy too. And I'm sure we will talk about this because I don't work with a lot of patients and clients that have Lyme, but I had one recently who we were working on something completely separately and she got bit. And she never saw what she got bit by, and she thought it was a spider. And so she had gone to the doctor because she thought it was a brown recluse. And they're like, we need to, make sure that you aren't poisoned and all of these types of things. And she kind of just brushed it off and didn't think of it. And then we started working together on something completely unrelated. And she was developing this symptom that she was calling air hunger. And I was like, what on earth? That does not correlate with anything you have going on. I'm like, okay. We went through everything. I'm like, you got bit. She was not by a tick though. And I'm like, well, let's just run down the rabbit hole. And sure enough, that's what she had. And she had one of the co-infections, and I'm sure I will pronounce it wrong. But anyway, cleared that up and air hunger went away. It's just the weirdest thing, And so can we start with where you get Lyme disease? Because I think sometimes it's not maybe where you think it is.
First of all, Lyme is an umbrella term that we use kind of ubiquitously in this country, especially to mean all kinds of things. Technically, Lyme disease is an infection with bacteria called Borrelia burgdorferi. There are multiple Borrelia species that cause human disease. They come and are transmitted on tick bites. There's some theories that there's some other biting insects that maybe can transmit it as well, but ticks are kind of the mainstay for that. We use Lyme to also mean often other co-infections as well. So you mentioned that word co-infections because ticks and other vector-borne illnesses, so other biting insects can also transmit other infections. Babesia is probably the one that your client had. Bartonella, Anaplasma, Ehrlichia, Rocky Mountain Spotted Fever. There's some viruses. The list goes on. There's a lot of these kind of infections that kind of get grouped under the Lyme umbrella a lot. So I get a little picky sometimes about the nuances of the names and the co-infections and kind of where we all get these things. But typically it's a tick bite, and ticks don't hurt. You don't see them, you don't feel them, you don't notice it until it's too late, which is part of the issue there.
Yeah, no, I agree. So with all of these co-infections, when you talked about the labeling, because you said that you're very particular about that, and I always hear like some interesting stories sometimes where people will come and they'll say, I have 8 versions of Lyme. And I'm like, how do you have 8 versions of Lyme? Is that like where other people are labeling co-infections that way?
It could be. There are, like I mentioned, multiple Borrelia species that cause human infection. So there are European strains that are more prevalent in Europe, or other strains more prevalent in Australia. They don't know any boundaries, so they go everywhere. And there are tick-borne relapsing fever species of Borrelia. So there are multiple Borrelia species. So you could have 8 kinds of Borrelia in your system. But yeah, I think most often when people are saying I have multiple kinds of Lyme, they probably mean Lyme plus Bart plus Babesia and other things. So it's important for the physician to know that and to know how to treat it, because they are treated differently. But at the end of the day, it's one big vector-borne illness pot. So
Yeah. No, that makes sense. Yeah, that makes sense. So I would like to kind of maybe go backwards. So if we could talk maybe about ways that you would come in to treat Lyme disease, or what maybe people should be looking for if they suspect, and then we could go into like how to prevent it, because that's where I'm sitting. I would like to prevent it.
Yes, please. Yes. Yeah. I don't want people to be afraid to go outside, because it's so healthy for us to be outdoors and be in the trees and be in nature. So I don't want people to be afraid. So prevention is key for sure. There are kind of 2 big stages with Lyme. There's acute Lyme, and then there's chronic Lyme. And if you can catch it in the acute stages, you can, in theory, nip it in the bud and kind of get rid of it. If it becomes chronic, it's a much harder issue. Acute Lyme, the quintessential diagnostic show is the bullseye rash. If you have that, that is Lyme, period, full stop, and needs to be treated. And it needs to be treated for at least 30 days. Most people never see a rash, or if they have a rash, it doesn't look like a bullseye rash. It could just be a red blob. It's not necessarily red, light red. Or maybe it's in your hair and you never see it because it doesn't hurt, it doesn't itch. It does tend to expand, so it starts little and then gets bigger. Well, it is kind of gross. It's actually the bacterium kind of spreading. That's exactly what it's doing. It's terrifying. And then the other symptoms that will go along with it are flu-like symptoms. So fever, achiness, fatigue. You feel like you've got the flu. And so it's easy to get missed and just kind of chalk it up as a flu or something as well, because it goes away. And after a week or so, those symptoms will go away. And if you didn't see a tick and you didn't see a bullseye rash and you didn't know it was Lyme, you could just miss it. And then it will turn into a chronic issue down the road. Some people will also get a swollen joint, or something called Bell's palsy, where half of your face kind of droops and you can't close your eye or your mouth properly. Those are some other signs of acute Lyme in and of itself. Chronic Lyme, different beast altogether. Chronic Lyme is also, I call it the great mimicker, because it can mimic all kinds of other chronic issues. So it can look like rheumatoid arthritis. It can look like multiple sclerosis. It can look like chronic fatigue. It can look like Parkinson's disease. It can look like Crohn's disease. It can look like and manifest as all these different things. So this makes it really, really tricky to diagnose and treat, because it looks like something else. Or a lot of people, though, what they feel, the common things are brain fog, headaches, joint pain that moves around. So it's your knee one day, it's your elbow the next. Sometimes there's swelling, sometimes there's not. And then fatigue, chronic, severe, debilitating fatigue. Those are kind of the 3 big ones that people will have. It can manifest as anxiety. It can manifest as dizziness when you stand up. And a lot of these people where you've had these chronic illness, you don't feel well. Something is different. You don't know exactly what it is. You go and see multiple different doctors. They tell you all of your labs are normal. There's nothing wrong with you. Here's your psychiatric medicine, right? That is unfortunately a very common pathway that people go through until they start to look for it and they find a provider who goes, maybe there's something else going on. What's your exposure to ticks? Is that a possibility? Maybe we should look into Lyme and co-infections.
Yeah. So within, let's say you suspect, within those first 30 days, is that when you do bring in the antibiotics, go to your doctor at ASAP and get on antibiotics? Is that what you typically recommend or no?
Yeah. Yeah. If you can catch it right away, you can often get rid of it. You can kind of clear it out. There are different versions of treatment. So some people will give 1 day of antibiotics. Some people will give 10 days. Typically, the big antibiotic to use is doxycycline. That's going to cover Lyme and most of the co-infections, but you really need 30 days. The life cycle of the bacterium is 28 days. And so you really want to try to get one full life cycle to try to prevent it to going into the chronic stage. And as long as your gut can tolerate the medication, because it can be kind of hard on the gut, it's better to stay on that for 30 days and really try to clear it versus taking it for a week or two, not being enough, and then having everything come back worse.
Oh, yeah. It's you can fix your gut afterwards. Get rid of the Lyme.
Exactly.
That's one of those situations that what was someone else on the other day? I don't even remember. And I was like, yep, that would be a situation where I would be take the antibiotics and we'll fix your gut afterwards. We will survive this.
Yeah.
Okay. And so then what about if it's chronic, I guess, is that where you need to start with testing to kind of see where you're at? Is it something that if somebody's been sick for a while, it's just in the panel, you're just hands down, this is what we need to start with running, at least to rule it out?
Oh, I wish the testing for Lyme were black and white. It would make my life so much easier. Unfortunately, it's just not. We don't have great diagnostics. There's definitely stuff in the works, and there's some stuff out there that's better, and some of the really good stuff's really expensive. Your typical doctor who will run a Lyme test, which God love them if they're looking for it and are willing to run a test, they're going to run a screening test, which is either called an ELISA test or just an antibody test. But that can miss over half the people. So to me, that's a very worthless test. A screening test is supposed to include too many people. And then you confirm it and you cut out people, not the other way around. So the screening test is miserable. And a lot of people will stop there and say, it's not Lyme, move on. The second step of that is something called a Western blot, which is you're looking at your antibody reactions to different proteins that stick out from the bacteria. And, the CDC requires a certain number of bands or proteins to be positive in order to be considered a positive test. Really, that's meant for surveillance purposes to be able to put a pin on a dot to say Lyme exists here. So Lyme literate docs they don't look at that same criteria necessarily. But the problem with this is we're not looking directly for the bacterium. We're looking at your antibodies. So those antibodies, so let's say you're really, really sick and you can't even make antibodies. Well, your test is going to look negative because you can't make antibodies, right? Or it could be something that you really did get infected and treated and it's no longer active in your system but you still have antibodies, floating around in case you come in contact with it again, like memory antibodies. So it's hard to decipher from these tests in a black and white way sometimes I can't tell when you got it. I don't know how active it is necessarily. So you have to kind of look at it in context clinically, and I'll draw other immune markers and take a really good history and put it all together and try to figure it out. And sometimes we have to do some out-of-pocket tests to look more at the actual bacterium itself, but none of them are perfect. And it's really frustrating. It makes it really, really hard. And then it's also hard to say, are we done with treatment? Are we not? So we have to use a lot of really good clinical history and background and detective work to figure it out.
Yeah. I think that just really comes down to, though, the art of reading labs. And that's why it's hard when you can't find a provider, someone that's going to work with you and okay, I understand my lab is telling you that it's normal, but I don't feel normal. So can you help me? Can we dig deeper opposed to just writing it off? So I don't know if you want to talk a little bit about treatment for long term, or that's probably so individual. If we want to, I'll leave that up to you.
Yeah, my approach to it is very individual. I take a very integrative medicine approach to it, which I think is necessary, especially with chronic Lyme, because it affects so many different systems in the body that you have to be able to juggle it all, and really hone in on the areas that need the most support. So I don't have blanket protocols that I put everyone on. Certainly there are, certain patterns that we'll use in certain meds or herbs or things that we'll use for certain kinds of infections, but we really tailor it to the individual person. And then we have to adjust, because treatment can make you feel worse before you feel better. It's this lovely Herxheimer reaction, or Herxing for short. It's a good thing, but it can be really miserable. So we have to juggle all of that. And we use meds, we use herbs, we use IVs, we use peptides, we use like all kinds of tools to help patients get better.
Yeah, no, that makes sense. So, what can we do? This is me and my kids. I'm like, what can I do to protect and prevent this? Because that's on my bucket list.
So there are a lot of different things that you can do. First of all, do a tick check. So if you're out and about playing in the yard, gardening, golfing, hunting, whatever, do a tick check. And they're small, so they're hard to see. Some people will jump in the shower after they've been out. That might help a little bit, but you might even want to just like feel in your scalp and your hair, because you may not see it. They will crawl up. They tend to crawl up. So looking in armpits and groins and behind your ears and things is important to look at that. If you know you're going to be out and about, and it could just be, walking in a nature preserve, but it could be gardening in your backyard, take those clothes that you're going to be wearing and spray them with permethrin. Permethrin is something that you can get at any sporting goods store. It's not very expensive. Spray your clothes outside because it is toxic, so you don't want to be breathing in large amounts of it. If you spray your clothes down, get them damp, let them dry, it's good for about 6 washes, and that will repel not just ticks, but other biting insects as well. And then you want to use some non-toxic tick sprays on your skin. I always butcher the pronunciation of this. I'm sure it's like Picardian. Ranger Ready brand is the ones that I use.
Yeah.
Yeah.
I have no idea how to pronounce that, so you're fine.
There's a Repel brand that has lemon eucalyptus oil. Those are non-toxic. DEET is really strong, but it's also very toxic. So I try to avoid that if I can. And then you can do things, be very, very, very stylish and tuck your pants into your socks so the ticks don't have a spot to climb up. Put your hair back, wear a hat, that kind of stuff. You can do things to help prevent ticks in your yard. There are non-toxic sprays. I think Wondercide is a brand. It's essential oils that you can spray in your yard. You can Google how to make tick tubes using that permethrin, put them in your yard. There's things you can definitely do to reduce the risk. And if you really live in an endemic area, there are some herbs you could take on a regular basis, like astragalus, as more of a preventative. So if you do get prevented, I want to say it's about 3,000 milligrams, 1,000 to 3,000 milligrams for an adult to take that every day. And there's drop versions and pill versions out there. You can go to Whole Foods and find some of that, but it's more of like a preventative. That if you're around ticks a lot, that is a good thing to do.
I definitely think, I love how you gave the toxic and the non-toxic, and people probably don't really care about my opinion here, but if I still lived in Connecticut, like where my family used to live, where like multiple ones of my siblings got Lyme disease and are still like dealing with the ramifications of having like long-term Lyme, I would 100% take that toxic stuff and spray it over my clothes and my kids' clothes and then have them wear that, because I would then take other ramifications to help their detox processes. It's like, I think it's all about weighing your pros and cons. It's like, where do you live? Is this like chronic, tick season? And do you constantly get bit? Does everyone around you get bit? I think it's something to take into consideration, because I know some people just completely write off things because it's like doesn't fit into this category of crunchy or non-crunchy, but it's like you also need to weigh like the long-term side effects of getting Lyme disease, and it's not pretty. So especially if you don't catch it in time. So I definitely think that I would, not necessarily just brush something off because you're like, oh, that sounds toxic. I don't want that in my life. It's like, well, maybe you may need it for a short term or whatever.
And it's really not too bad if you spray your clothes, the outside of your clothes, it's going to be less of an issue. You're not going to be absorbing so much of it. If you get really sweaty in those clothes, you might. That's why you don't want to spray it directly on your skin, and you don't want to be in a closed room when you spray it so that you're not breathing it in. But it kind of reduces the toxicity of it. But you're right. Like you're weighing the pros and cons and the benefits of all these things, right? And kind of just figuring out where the middle ground is.
Yeah. Can you tell me like your favorite story of like somebody who's come in and then there are symptoms that just seemed like off the wall and it turned out being Lyme?
Oh, wow. Gosh, there's so many of them. I have to think of a good one. This is like my daughter asked me to tell her a story every day. It never ceases to amaze me though, because there's so many unique stories that come in. You're just like, wait, how is this going on? And my radar is so high for these things, for better or for worse. I tell people you came to a Lyme doctor, so I'm going to look for this, even though it may not seem directly relatable per se. It could be a lot of balance issues, or, you hear stories of people getting diagnosed with ALS and it's not ALS, it's actually Lyme.
Oh, wow.
And, just weird vocal changes and nuances I've seen related to Lyme. A lot of GI stuff actually you wouldn't necessarily think of can be related to Lyme and co-infections. And it's, even, to the point where people are about to start really heavy rheumatological medications, which can have their own set of side effects and problems. But it's not just that. It's actually a Bartonella infection. You treat that and their colon gets better.
That's crazy.
Yeah, it's pretty fascinating how these things are connected.
Yeah. And I mean, amazing for them to like get their life back of like, trying all these random things. That's so interesting. Like how it just mimics multiple things. Do you find like Lyme goes along with anything? Like, do you find that like most people that have Lyme end up on getting other things because like immune system is compromised? Like, are they people that start to go down maybe the mold and mycotoxin route or things like that before they go, oh, I actually have Lyme?
Yes, there are definitely some common patterns. Lyme absolutely can lead to autoimmune diseases of all kinds. One of the things that it does, it's so smart. It will literally change your immune system. So lives inside the cells and tries to kind of cover up. It actually changes its own form inside your cells to protect itself. And it turns your immune system that attacks your intracellular organisms off. And it turns the part of your immune system that's on the outside that deals with autoimmune stuff up. So it
Oh,
cranks up that part of your immune system that actively is going to attack self and turns down the part of your immune system that will fight the infections inside the cells. It does this on purpose to protect itself, right? So that if you are someone who's genetically predisposed to an autoimmune disease, you're at much higher risk of developing one because you got Lyme disease because of that shift of the immune system. It just cranks up that autoimmunity. So that's one of the reasons why it can mimic a lot of these diseases, like rheumatoid arthritis and multiple sclerosis, because it's actively turning on your immune system to do that on purpose, which is wild, right? It's so
freaky.
smart. Yeah. Yeah. It's like, it's brilliant, but terrifying at the same time. Yeah. But a lot of these patients, yeah, it's very common to see mold issues, mast cell issues. We
Oh,
see a
yeah.
ton of long haulers. I virtually have
Mhm.
no long haulers that are not positive for a tick-borne infection. Um,
Wow.
there's a lot of immune system overlap with those two things. So yeah, you start to see these patterns emerge.
That's crazy. It's kind of like those creepy robots that like take over, like you create them and then they take over the world. That's like what they're doing in your body, man. Ah,
Think about it too much. It's too much.
yeah. Okay, so I would like to talk a little bit about like the hormone connection with Lyme disease, and specifically since we talked about autoimmune, could we talk about Hashimoto and thyroid issues? Because I think that's pretty prevalent for a lot of women.
Yeah, there's so many different things that Lyme can do to affect hormones. And so one of the things is specifically with thyroid and with Hashimoto's, which is autoimmune thyroiditis, one, it can just turn on the immune system, like I just mentioned, and kind of if you are predisposed to it, it can just turn up that part of it. But one of the things that's really interesting is there's something called molecular mimicry. And there are something like 16 proteins on the Borrelia bacterial species that closely resemble different thyroid proteins, thyroid receptors, thyroid proteins, etc. So if you get exposed to Lyme disease and your body starts making antibodies to fight off the Lyme disease, then those antibodies see your thyroid and they think it's the Lyme. And so they start attacking your thyroid. So it spurs on directly an autoimmune thyroiditis in certain patients. Because the immune system, God love it, it thinks it's helping. It's like, I'm found in more Lyme, right? But it's not the Lyme, it's actually the thyroid that it's attacking. So it can very directly cause thyroid issues. And hypothyroid issues, typically it's going to be more towards the hypothyroid side of things for the autoimmune that's caused by Lyme versus Graves, which is more hyper, but I have seen that too. A lot of the symptoms for Hashimoto's sound exactly like chronic Lyme. Fatigue, joint depression, they overlap. So
Yeah. And then you go on thyroid medication and you're like, finally got your doctor maybe to run that lab. And then it's like, why don't I feel better? And things just keep getting worse. That's so interesting. So many, like, I feel like puzzle pieces have got to be coming together for people as they're listening. Cause I'm like, this is so interesting. I feel like, the more I learn about these things, I'm like, you need to have like the questionnaire for onboarding new clients. I'm like, it's just getting longer. I'm like, I need more answers as I learn more of these things. It's cool. So let's say then like someone is like, okay, a lot of these symptoms are making sense to me. Like where would they go? Like what do they do to start maybe looking into Lyme, or like where do they go to start seeing, is this my issue?
you could definitely start with your primary care, but I would suggest you go find a Lyme literate doctor, somebody who actually has studied and tested this and is on the lookout for it. Because you run the problem of getting that screening test, which is crummy, and then getting, pushing everything off for another 5 or 10 years. If you have a doctor who's willing to run the Western blot, that's a good start. But the Western blot through typical labs is still not as good as some of the others. Like IGeneX is one of the better ones, or private labs that are going to actually look at this in much more specific detail. ilads.org is a great place to start. That's the medical society designed to teach providers how to treat Lyme disease and what it is. They have a provider search on there, so that you're going to be able to find somebody hopefully near you who can do the right proper testing for you. Because you want to do it, you gotta look for the right stuff.
Yeah, no, that makes sense for sure. And how can people find more information about you and all of that stuff?
Sure, yeah. You can go to our website, caseintegrativehealth.com. You can learn more about us. You can set up a discovery call to see if you're a good fit for our practice. We do see patients from out of state, but they have to be established in Illinois, if that makes sense, because we're in Chicago. So we do need to see patients on a regular basis in our office, but we have patients from all across the country and around the world that come to see us in our office. And we deal with more than just Lyme disease. We kind of take a holistic approach to all kinds of things. We have a cardiologist on staff. We have a pain specialist. We deal with hormones and all of the other kind of chronic issues as well. So we do a good job, I think, trying to kind of dig into these chronic mysterious issues, but also just trying to optimize health. We do, some patients who just want to optimize their hormones and feel better. And, we can do that too.
Yeah, knowing like maybe I feel okay, but I would like to feel optimal. Yes, it's always a good thing.